Welcome back. Well, we have Dr. Damon Anderson here, and we're going to talk a little bit about implants. Well, welcome. Nice to see you again.
Thank you, Lisa. Nice to see you.
Now, we were just kind of chit-chatting a little bit beforehand about implants, and as we were talking, it's somewhat of a specialty, but you have expanded to do these for many, many years. Tell me why you decided to do that.
Well, I found that there are many patients that do not want to see a specialist.
Okay.
They get up the courage to see a doctor, they gain trust with one doctor, and they want that doctor to do everything. They don't want to meet anybody new, they don't want to drive somewhere else. Mm-hmm. So I had been doing oral surgery for quite a while, removing teeth, and then learning bone grafting, and then the next step is to place implants. This was back in 2016.
Okay.
So I've placed quite a few implants since 2016.
So at what point does somebody need an implant?
Well, for decades, people have been getting bridges,
Okay.
which is basically 3 crowns connected together, and you have to drill on the front tooth and the back tooth, and then glue a bridge on. It looks like 3 teeth. An implant what's better about an implant is you don't have to drill on the teeth on either side. You can leave those teeth alone.
Okay.
You put a screw down the middle of the bone,
Right.
and then the crown just screws onto that.
Oh.
Right, and you could floss. You could floss around it.
Right, so it's like having a regular tooth.
It's like having a regular tooth.
Okay. So now tell me the process. So you've got, we're looking at a kind of a diagram here about your bone is on the side, and then the implant is the screw, right?
Yes.
Okay, and what is an abutment? Is that like a cushion?
It's a middle piece. You can't really see it. The abutment, these days, the abutment and the crown are typically glued together in the lab before it arrives.
Okay.
So I just put the whole thing in with one screw.
Okay.
But it used to be, it would be a 3-piece situation. Now it's pretty much a 2-piece.
Okay.
Yeah, it's faster.
And before we used to have to bite on those things and all that goo, but now you
Right.
don't have to do that, right?
We do have the scanner.
Okay, so
We do
what
have an
is
intraoral
the
scanner.
scanner? Oh, intraoral scanner.
Intraoral scanner.
Okay.
That's for scanning the crown. But before you get to that point, this is called a cone beam scanner. And I do this before, this is part of my treatment planning.
Oh, okay.
Yeah, so that's a 3D. That's how I get the measurements within the bone, so I can have the right inventory
Okay. Okay.
for the screw part.
Yeah. So now what we're looking at is obviously what you just mentioned is the 3D cone. Now on the left-hand side, though, is we've got the implants. So that's the screw and the, what is that on the top?
Those are snap-on abutments.
Oh.
That's the middle part. This gentleman here, and I have his permission to use his photos.
Oh, of course.
I made him a full arch. He didn't want a denture. He didn't want anything touching the roof of his mouth. He just wanted like a horseshoe-shaped arch of teeth.
Huh.
And so those just clip right on with a special tool. They just snap right on. Yeah.
Does he take them off?
He can't take them off. I can take them off with my tool.
Oh, okay. So
I have to have a spring-loaded tool to get those
how
off.
do you clean?
Water pick. You just stick the water pick
You
up
don't
in
even
there.
need to. Oh, that's wonderful.
And then once in a while, like once a year, come back and I'll click that thing off and give it a wipe and clean around the implants and snap it back on after the hygienist cleans it.
Wow.
Yeah.
How long has that been around?
Maybe 15 years.
Okay. Wow.
But actually, there's been a form of it around for 15 years where you could, but those use screws, and some people use the screws. This is a special technology called an FTX, and it's made by a company called Zest, which is in Carlsbad, California.
Okay.
And they make the special spring-loaded snap-on.
That's really
It's great.
That's an amazing thing. So if you don't want to go for a full implant situation, you can do this.
Right, yeah,
Okay.
you need at least 4.
Okay, gotcha.
But I did 5 just in case one didn't
Okay.
work out. I'd have still 4.
You have 4. All right, that's great. Now, when we talk about implants, is it painful?
No.
Okay.
My patients don't complain of pain. It's,
Okay.
I would say the experience is similar to getting a crown.
Okay, so, but
It's-
then, some people might be uncomfortable, right? So they would go ahead and maybe do sedation.
Yes,
Okay,
some.
nervous or something like that.
A few, I would say in the minority. Most people who have the courage to get implants, I would say don't need sedation. I'd say 3 out of 4.
Okay.
And then that 4th one wants it Just to have it.
Just to become, okay,
Yeah.
just to have it, to be on the safe side. Now here's another photo here. Now this man,
Mm-hmm.
he looks so happy.
Yes.
What did you do for him?
Now, on the right, that gentleman, I actually did another all-on-4.
Oh, okay.
Yes. On the left, that's a different patient.
Okay.
And he had a 4-unit bridge on 3 implants. You could see where I took out a tooth towards the front.
Mm-hmm.
And so you see 3 implants, and then I hung a tooth off the front to close the gap where that missing tooth is.
Oh, I see.
So I placed 3, took out the tooth, and then he came back and I put in a bridge.
Wow. Oh, wow.
Yeah.
Interesting. Well, there's so many different ways that you can
yeah.
do this, right? Depending
Right,
on
absolutely.
what is needed. And I assume you sit down and you give them all the options?
Oh, absolutely.
Okay.
Absolutely. I
Okay.
kind of had to talk him into this. He wanted to go small. I said, nah, let's go big. He said, all right, why not?
Now, insurance, it's always kind of touch and go with them. How does it work with implants? Do they pay for it or not?
They do. These days they do.
Okay,
Usually
that's great.
half.
Oh, that's great.
Usually half. And sometimes we'll time it, so we'll get the implants in 1 year.
Mm-hmm.
It takes 3 months to heal anyway. And then we'll roll over through January, and then their insurance renews. And then so they're paying for half the implants, and then they'll pay for half the abutments and crown
Okay, good.
in the new year.
Oh, that's great. Okay, good. And then real quick, I just wanted to touch on some of the sedation patients that you have, which is really unusual. You have people who might have some sort of a movement disorder. Tell me just real quick about that.
Yes, I have become aware that there are many patients that are being seen by neurologists for different movement disorders, Parkinson's disease, cerebral palsy, things of that nature. And sedation will calm their involuntary movements enough to get dental work finished.
That's great.
And they have problems with saliva flow, and the medications are giving them dry mouth
Sure.
and things like that. So they need extra care and regular care, and
Okay.
sometimes they're fearful. And because they're worried they're going to be moving around.
Yeah,
Yeah.
that would be worrisome, but that's great that you can help them out.
Yes.
So let's, the last thing I'm going to show is your photo of your team, which is
Thank you.
awesome.
Yes.
And of course, if they want to get in touch with you, there's the number and also your website.
Yes.
And who is the gentleman up in the back there? Is he an assistant?
That
or-
is Dr. Kenneth Hines.
Okay.
I bought the practice from him, and he worked for me for over a year.
Okay.
Yeah, he
Nice.
just retired.
Oh, did he?
Just retired a few
Oh,
weeks
okay.
ago.
Oh, no, okay.
Yes,
So it's just you now.
just me now.
All right, so they'll call on you. Perfect.
Mm-hmm.
Well, thank you for the information.
Thank you.
You're welcome. And if you want more information about implants or sedation, you can always get in touch with Dr. Damon Anderson's practice at the number on your screen. We'll be right back.